Hi, I'm Rose. I'm an occupational therapist. In this video, we're going to be talking about cancer-related fatigue that affects many people living with cancer. We'll explore cancer-related fatigue and how it differs from normal tiredness. There are lots of things you can do to help you manage your fatigue, and we've got a separate video which will go over some of these. Different people have different experiences of cancer-related fatigue. In this video, we'll also hear from Gill, who will talk us through her experience. Fatigue is an extreme feeling of severe tiredness or exhaustion. Most people with cancer will experience fatigue at some point. We all feel tired and we expect to feel tired, but fatigue is more severe than normal tiredness. You might get tired more quickly or feel fatigued after less activity than you'd expect. You may also not feel like a good night's sleep resolves your fatigue. Unlike tiredness, fatigue can feel overwhelming. Symptoms will vary for everyone. It can be different day to day, and it can also be different throughout the day.
Hi, I'm Gill and I'm a 2-time breast cancer survivor. For me, tiredness was more a physical thing. If I'd done some exercise, bad night's sleep, maybe a lot of reading, I might feel tired. Fatigue was totally different. It was an absolute exhaustion, and it also impacted how I felt about doing something. You know, sometimes I could absolutely dread having the thought of maybe even going out, hanging some washing out, doing anything physical, and that was fatigue, and that was at any time of the day.
For most people, fatigue will improve or resolve after their treatment ends. But for some people, it could go on for weeks or months, or sometimes even years. What are the symptoms of fatigue? These can really vary person to person. For some, they'll be incredibly mild. For others, they can have a really big impact on things that they need and want to be able to do. This might be things like physically feeling strong enough to do the tasks you need to do, being able to concentrate, or might affect how well you're sleeping. Fatigue can affect you in many ways. Some examples might be feeling like you don't have the energy to get up and ready in the morning, struggling to concentrate in conversations, losing interest in sex, struggling with your sleep, or finding it difficult to manage what you need to do at work. You might also find that fatigue affects your mood or makes you feel more emotional.
So fatigue impacts my ability to do more long distance sort of exercise, something that was more strenuous. I've done a marathon before I had my first diagnosis, but now I can't even do a park run. So it's, I have to walk, but I can't really do the heavy exercise that I used to do. It impacts whether I could have had a good night's sleep, but I still don't want to get up in the morning. So I still have to have longer in bed. And just the thought of doing something just becomes an absolute chore, just because how fatigue has impacted me. I used to love doing gardening, and I'm talking strenuous gardening, and now I'm lucky if I can do a little bit of weeding and tidying up in the garden. Something simple like putting out the rubbish is a real effort. I struggle cooking meals sometimes, so I get my husband to do a lot of the preparation and I'll do the nice stuff. But even then after dinner, clearing up the table afterwards, yeah, I've got help, but it's just something so simple that you want to be able to do yourself and is a real struggle.
What causes fatigue? We don't fully understand, but there can be many contributing factors and reasons. Here are a few. Being diagnosed with cancer and managing its effects can feel really overwhelming. It can make you feel stressed, anxious, and lower your mood. This can also have an impact on your fatigue. Cancer treatments can affect your immune system. Your body is going to need more energy to help repair and heal. Fatigue can also be caused by a buildup of chemicals from your cancer cells being destroyed. If your red blood cell count is low, you might not be getting the amount of oxygen you need, which can make you feel really tired. Doctors call this anemia, and it can be caused by the cancer or cancer treatments. You may get tired if you're not eating enough, or if you're not able to get enough energy from the food you are eating. Some people may find that they're still losing weight even though they're eating a lot. This can be due to the cancer or sometimes the treatment. Having cancer doesn't mean you will experience pain, but if you are, it can affect your fatigue. It's really important if you're experiencing pain that you get support in ways to help you manage this. Fatigue can make you feel like you want to sleep all the time. It can also affect the quality of your sleep or make it difficult to keep to a good sleep routine. Having other health conditions as well as cancer, such as heart problems or diabetes, can also affect your fatigue. There are also certain medications that can affect how tired you might feel. If you've experienced any of these effects and are worried about them, please speak to your GP or cancer team. Before fatigue can be managed, it needs to be properly assessed. A healthcare professional might do this by completing a fatigue assessment or a holistic needs assessment, which is a questionnaire that will go through some of your symptoms affected by cancer. This can be done around the time of your diagnosis, during your treatment, or at the end of treatment. But if you experience fatigue at any point, it's really important you let somebody in your cancer team know. Some people feel that fatigue might not be as important as some of the other side effects, but it can have a really big impact on your quality of life and being able to do the things that's important to you.
I did a holistic needs assessment as recommended by the hospital, and that meant talking to a cancer nurse and going through a lot of the elements that people living with cancer, the problems that they experience, including fatigue. And it was a really useful conversation because they helped to signpost sort of little areas or places who were able to help, including local groups, support groups. And it was really helpful to talk to other people who've been through the same as I have.
There's lots of support that's available to help you manage your fatigue. You can ask your specialist nurse or GP to refer you to an occupational therapist like me or a physiotherapist. You may want to speak to a trusted friend, family member, or healthcare professional. If you're experiencing anxiety or depression, have a chat to somebody in your cancer team or your GP. They can refer you for counselling services or talking therapies. Support groups can help you connect to people who understand what you're going through. These can be specific to cancer types, different treatments, and also different communities. Other online support is also widely available in different forums, blogs, and social media sites. You can also join Macmillan's online community where people share their different experiences and support.
So I got support from a number of different places, both virtually and actually in person. So friends and family have been great, particularly other friends who've been through a cancer diagnosis. I called the Macmillan support line, which was brilliant, and it was really lovely to talk to a nurse there. And I find local support groups are really good as well. They understand some of the local facilities and support available. So yeah, I've had quite a bit of help and it has been really useful throughout my experience. Something else that I did find useful was actually through work, and that was an employee network group for employees living with cancer. And it's been such a fantastic support group for me.
For most people, fatigue gets better after treatment, but for some, it can last months or years. Remember, fatigue is real, and it's important you get the support you need. For more information, visit macmillan.org.uk or call the support line on 0808 808 0000.